And I think it's recording. Okay, so here we are this morning. We're just going to be talking to our public health department on the Leo O Aiga Health Information Center. And we have with us today Anna and Melinda. So go ahead and tell us about the Leo O Aiga program.
Thank you, Sandy. So Leo O Aiga Health Information Center, also known as Family to Family or F2F. We are under the Department of Health, housed under the Maternal Child Health Program. So our program, we cater to families with kids of kids with special needs, or children and youth with special healthcare needs. So our goal or our mission is, or for our program, is that we want to create strong partnerships between families and professionals. And that's by working closely with them, with the families and the service providers, so that they can make better decisions for these kids. We provide health education and information in our office. Our program also provides advocacy and support to families of our program. We also provide workshops, parent workshops, even service provider workshops, the professionals, the providers that provide services to our population. We also, so the thing is with our program, we do not have direct services, but we do referrals and we provide resources and information. The other thing with our program, we do provide peer support. Just last year, we started a autism program. We're trying to build one, and we also have a autism registry. So there are not that many services for the autism for kids on the spectrum. So that's what we're starting here. So parents do come together, and so we have a support group for these parents. So they come together, they commit to share their, they're here for emotional support and to share information, practical advices. So it's a safe space here. They do meet here every last Wednesday of each month at 10 a.m. in our family center. So that's one service that we provide, is a support group for these parents. The other thing is with our program, we do partner with the Department of Public Works, the Dollar Ride program there. So we provide Dollar Ride vouchers. So if your child is enrolled in our program and you feel like you need their service, we'll automatically enroll them into Dollar Ride. And then we provide you with the voucher so that you don't have to pay every time you need their service. And it's good. It's good so that parents will always have a way to get to their appointments, so transportation shouldn't be a problem. The other service that we provide, which I find that a lot of parents use it, and it's a need here in American Samoa, is that we provide medical expense assistance. Now, we cover for medications, for medical supplies, anything that's not covered under Medicaid at the hospital. It has to be from LBJ. So you do come in, like if you need to pick up medication, you just need to pick up a form from us, and then you just take it to the pharmacy and they'll cover the cost of medications. Right now, it's like if you're non-resident, if the child is non-resident, I think right now for inpatient services, it's like $200 a day. So yes, that's going to have to come out of your pocket, but you don't have to, because our program can cover those expenses. So that's another incentive from our program. But yeah, our program is pretty much run by parents of kids with special needs. I too am a mom of a 2-year-old that's suspected of autism, and even our parent lead, our program director. So yes, it is run by parents of kids with special needs. Now, our office is located in Whangatongo. Our services are free, so it doesn't cost you to enroll your child. You know, if your child is suspected or has a developmental disability, they are eligible to enroll in this program. And we work closely with our sister program called Children and Youth with Special Healthcare Needs, or SHIN. They help coordinate care. They can schedule your child's appointments when it's due for a dental or when it's due for a checkup. They schedule and they call you, and that's the beauty of it. So we can assist you with care coordination, the transportation, we have that covered. Medication, cost of medication or hospital bills, we have that covered. So all those things our program can provide them.
Nice. So if a parent is thinking right now, oh, how do I get involved? So over here you have required documents. They need to bring to you their birth certificate, the child's birth certificate, parents'
That's
ID,
correct.
passport, immunization card, and then you'll fill out an intake form and get registered with your program. And
Yeah,
then from there, they can move into these other things that you provide, right? Yeah.
yes, definitely. It's very simple. We just need your child's birth certificate. You don't even have it, some parents they say, oh, well, we didn't get our immigration ID yet, or our paper is not official yet. It's okay. We're not going to need anything from any other legal documents except for the child's birth certificate, your parents' ID, any photo ID, your child's immunization card, and because the care coordinator or the client navigator would love to check their vaccinations, see if everything is up to date, their immunization, they coordinate that as well for you.
Okay. On the immunization, if a child doesn't have their immunizations up to date, or perhaps the parents have opted out of immunizations altogether, does that make them ineligible for the program?
No, no, it's we would stress the importance of them to get their immunization. We'll coordinate that for them. Like if is it we want to, because there's some parents that are afraid to take their kids in because the surrounding is too crowded for the kids.
Yeah.
We'll help accommodate that. We'll communicate to the staff at the clinic, see how they could accommodate these kids because of their needs. But then there are some kids that are bedridden. We'll reach out to the nurses, the home visitor team, to go out to the homes to give those immunizations.
Yeah, and
But
you do really go out of your way. It's really nice. I remember all the times Jasmine would have significant anxiety when we'd go in for her cardiac appointments, but you'd always allow us to schedule at the very end of the day when nobody was there. And it just was so helpful. We really appreciated that. Yeah.
yeah, but it won't prevent them from like being eligible to enroll. No,
Right.
we'll
It's good. Great. Okay. Any other things?
Melinda, did you want to add anything? Did I miss anything?
No.
Okay.
No, not that I can think of, but I just want to stress that Leo O Aiga, we're kind of the middleman to getting the services that's required for your child, right? So if the child is, like you say, Sandy, my son is 7. He's also autistic, so taking him to medical appointments, it's like you armor up when you go in because you don't know, something might make him unhappy, or the room is too crowded for him, he's overly stimulated. The care coordinator is very helpful in terms of facilitating that part for us. As a parent, it was very helpful to have her there with me and my son. And then I think I'm answering, I don't know if this is something to note, but if we are the, yeah, I guess we're the middleman. I think that's the best description I can give, is that we are the middleman to help smooth these transitions for you, to help parents learn to advocate for themselves, right? Because we're not always going to be available for everybody all the time, but we're here to kind of just support and motivate, inspire, and impact them to be advocates themselves towards, every aspect of life that their child's going to go through. So health is, yeah, the service that I got from Shin, awesome. It was very, very helpful, and I'm thankful for that as a parent. Thank you.
Yeah. Yeah, and your program run by parents, same with PCSN, pretty much run by parents, and out there to help support parents and be that middleman for advocacy. So just kind of recapping, you have your autism support group the last Wednesday of every month, 10 o'clock at the center. And that's a group where parents, that's so valuable. Talking to another parent who's going through the same thing is sometimes, I think, a lot more valuable than talking to a healthcare provider or somebody who doesn't have a child with disabilities. You can gain so much from one another experience. So that's great. You also provide dial-a-ride vouchers. Now, do they need to come down to you for every new voucher that they want? Like, say they're going to go to programs 3 times a week. Do they have to come to your office every time, or like once a week, or how do they work that with the vouchers?
So usually if they do need to use the dial-a-ride service, I always tell them, like, give a heads up, a day or 2 heads up, so that we can figure out a way to get the vouchers to you. I usually give out 10 minimum to them. And I tell them, when you're low, you're down to like 2, let me know, and then I'll give you some more. There are some clients, they use it frequently throughout the week. I give them more than 10, maybe 20. But then there's so many clients in the program that I can only start off with just 10.
Well, that's great to know, because I was thinking I have to go down there every time I need a voucher to go to, I need to get a dial-a-ride to go down to Leo Aiga, a voucher to get a voucher. That's great.
And we'll work out a plan, like maybe I can drop them off on my way to an appointment, or
nice.
Pick it up if you are around the area. But yes, we always try to see what works for them, better for them.
And then your medical expense assist program, it's good to remember that these are for medical expenses, like medications that you would get just from LBJ. Is that right? So
yes,
what about the Department of Health pharmacy? Can they pick up from
that? Satellite pharmacy is actually LBJ.
It is.
I know a lot of
it's
DOH, but no, that's LBJ. So yeah, you can use it there as well.
Okay, and the same with the DME, like if they needed a crutches or wheelchair, it would have to come from LBJ in order to be covered by your program. It can't come from one of the other programs on Island. Okay, so that's good, just to make sure we know. And then,
I'm so sorry. Just clarify something real quick. That with the DMEs, it is limited to the maximum per client is 500 for the DME. So if it's something that needs to be purchased that's over that, I mean, we could only cover it up to 500 per client.
Okay, yeah, that's good to know. And your services are free. And I like the help to schedule appointments. That was nice too, because sometimes it's hard as a parent trying to schedule an appointment. And like you said, with your considering the special needs, if your child is, bedbound or wheelchair or has anxiety, difficulty with crowds, lights, it's really nice to have that advocacy there to help you navigate the system and get your way through.
I want to add on to that, with the schedule. Good thing about being in the SHIN program, when we have specialists from off island, we do prioritize our clients where we schedule them to see these specialists where they're on island. And not a lot of people know about, like, let's say with Jennifer, when she's here, the speech pathologist, when the team from the cardiology team is from Oregon or Utah, we schedule them to see these specialists, even the eye specialist from Oregon. We always have like a Saturday, a clinic specifically for kids with special needs. So if you're in the program, we do prioritize your kids when these specialists are on island.
Mhm. Nice. All right, that's great to learn. I learned a lot today. On this screen right now, you'll see, I'll try to bring my, where is it? There. So we have the phone numbers 633-4008, 633-7544 to get the office. Your office hours are Monday through Friday, what, 8 to 4?
It's from 8 to 4 o'clock. There will be days that we are going to be outside of the office. We're out in the field, like for a training in Tafuna or out in the field doing outreaches or school screenings. You are welcome to call 219. Call 219 and you may ask to just ask the operator to transfer you to our cell phones.
Okay. Okay. And
But yes, can be reached at 633-4008 or 633-7544.
okay. And then there's the family to family American Samoa at gmail.com. It's actually F2F American Samoa at gmail.com for the
Yes, that's correct.
email. And you're located just actually right next to the post office, just on that
Mhm.
that building. And then the Facebook page, I actually have that pulled up here somewhere. Here's the Facebook page. So if you want to just get some casual information about what's going on right now, you can look up the Facebook page here. Yes. Okay. Anything else? Good. Very good.
If I could just stress our parent support group. I think we've got a year under our belt with our parent support group now. Is that correct, Anna?
It's been longer than a year.
So the importance of this is we got it together for because of the numbers of families with autism, and most of our community are undiagnosed. So the registry was curated to kind of get an idea and a number of how many we're looking at, so that we could try and make our voices and make it, so that we could get some help more, because currently right now we don't really have a lot of help with children on the spectrum. There's not very many specialists here. And so this started as just a group of parents that thought that they were the only ones here with autism, and it was a place where parents could come and kind of share and connect with each other, building stronger network with each parent, and kind of just voicing concern. It's where we've curated the direction of the autism part of Leo O Aiga, that we're starting to look at other ways that we could parents could reach out into like the schools, how they could go in themselves and advocate for their own children in the school and in the health area here in American Samoa. So if anybody's listening to this and you feel like you're alone, please join us. We're here every every last Wednesday of the month. Join our parent support group. It's just parents that are going through the same thing. You're not alone. I just want to just stretch that point out. If you're here, because we've got a pretty good sizable community here in American Samoa with family members with ASD. So join us every last Wednesdays of each month.
All right.
Thank you.
Great. Yeah, I'm so glad to know about that. Okay, well, thank you very much. I'm going to find the stop record, maybe. I don't know where it is. I will pause it for right now because I don't know how to stop it. Oh, screen sharing is still, oh gosh, it was right here a minute ago. And now I can't find to stop it. Okay, I'm just going to end it because I can't figure out how to stop it. Okay. right, thank you.
Bye.
Bye.
Like, okay, how do I get out of the
Yeah,
screen?
me too. I'm trying to figure out. There we go. Stop recording.